Next Dorothy, 641. Most of you have heard of liposuction. Maybe you've heard of LipoDissolve, but now there's a new procedure. It's called LipoLaze.
Yes, it's a non-invasive way to tighten your skin and lose some fat. Non-invasive way. And a doctor you may have seen here on Good Day is the only plastic surgeon in the world who is performing the procedure. Jen is with Dr. Mark Solomon this morning in his Bala Cynwyd office. This should be a neat deal. It's non-invasive. That's the key, right?
It's non-invasive. You can do it right here in the doctor's office. And yeah, Dr. Mark Solomon basically invented the whole thing. You came up with the way to use the length of the laser, correct? That's the part of it.
Wavelength.
The wavelength.
The wavelength.
And first of all, we want to show people what we're talking about. We have a picture of a woman who had, is it some fat underneath her chin?
Loose skin.
Loose skin.
The skin is a little loose.
Okay.
There are not a lot of ways to treat it that are not surgical except this or doing a neck lift, which is a surgical procedure. So putting this laser in and tightening the skin is a really nice way to go to get this better without a surgical procedure.
And these, we're doing today, we're going to do a gentleman's eyes. And by I mean you are going to do some guy's eyes live on TV. Explain for people, what exactly are you going to do? You're going to put like a little thing in there?
We're going to numb this up.
Okay.
We're going to put a little needle in, and we'll turn the laser on, and you'll see a little beam of light demonstrating where there are little fat bags under the eyes, and we're going to melt those fat bags, and then in about 30 days, the skin tightens up.
Who is this not ideal for? Who is not a candidate for this kind of thing?
Well, this laser can be used for people with a lot of body fat, but you're still going to need an operation where we have to suck out that body fat.
Okay.
So it's not ideal. It's great for them in that position. It's great for men with breast tissue because it melts the breast tissue and then we can suck it out so they don't get a lot of big scars.
Okay.
It's not good for people who need traditional eyelid surgery or if you need a facelift. It's really not going to fix those problems because those are not just loose skin. That's a quantity problem. There's too much skin.
But to be clear, we've been before where we show Botox and eyelash extensions. This is far more serious than something like that.
Correct.
Okay.
Yeah.
And the other thing is that we said it a couple of times. You're going to numb them, but they're not going to undergo general anesthesia. Does that make it safer in some way?
Well, it's simpler in that it's in an office setting. And if you can avoid a general anesthetic, that's nice, but frankly, general anesthesia is among the safest things I can think of.
Okay.
But it's less aggravation, it's less downtime. You can come here and then you can go home. You don't have to sit in a surgery center or an operating room or a hospital. And
real quick, we have to wrap it up, and I guess I'll say this. Basically, you use this in conjunction with traditional liposuction as well. Like, guys, here's how it works. Like, let's say you've had a lot of liposuction and you still have some loose skin.
Right.
See, I'm like practically a doctor. This thing can like tighten up the skin around it. So coming up at 7:45, we're going to do it live. And you're okay with us being here?
Sure.
Well, hopefully we'll get your shot cleared up because I'm trying to pay attention. It's like, so we'll get that cleared up for you.
Maybe the good doctor can fix the winds, that are out there. We'll work on that. All right.